apply our skills in order to create a beautiful artwork, because the lips of our patient, the faces of our patients, these are also our artwork. Okay? So there has been a growing trend, especially for our young generation, uh, with regards to lip rejuvenation. Okay. Usually there are millennials of about 18 years old to 35 years old. They are the ones who are very interested because they see it, they're active in social media, and they see it as well. The most popular celebrities who are the Kardashians, they promoted lip fillers, and everybody wants to follow them. Everybody wants to look like them as well. Okay, so there's that desire to look attractive as well as to
Muốn cái
follow
môi được
social media.
hấp dẫn hơn.
Okay, so our patients want this.
Ờ,
It's either they want
bệnh nhân của
growth,
chúng ta
they want
muốn
pigment,
làm
or
cho
low.
môi đầy
But
đặn, rõ nét
nowadays,
và
more
vẫn
and
trông
more
rất là tự
patients, they
nhiên.
want to look natural. Okay, so again, it's
Một lần
about
nữa,
whether they want soft
một
or
là họ sẽ muốn những cái môi tinh tế, mềm mại, hay là họ sẽ muốn những cái môi đầy đặn. Đây là hai vấn đề mà chúng ta cần phải suy xét và tư vấn cho khách hàng. Trước khi tôi đánh giá về giải phẫu, tôi muốn nói các bạn nghe đây là cái môn rất là dễ dàng, nhưng mà cũng rất thỉnh thoảng sẽ có những cái biến chứng như là phù, hoặc là ô cục, hoặc là bầm máu. Bạn có thể nói nốt ô cục ở da khi mà sử dụng sản phẩm không đúng, hoặc có thể là khi sử dụng loại filler đúng nhưng mà lại lượng quá nhiều. Ờ, Bầm máu có thể do một cái biến chứng về mạch máu.
Subtle and more precise in doing your injections. Now, the thing that we dread the most, or we are afraid the most, would be vascular occlusion. Okay, because of course your lips are supplied by your arteries, and if you inject accidentally into an artery, you can cause vascular necrosis of the skin or of the lips. Okay, so that's why it's really very important to learn about anatomy. Okay, before, a long time ago, I was lazy. I don't, anatomy is boring. I just like to inject until I encountered the vascular problem myself. Okay, starting that, then I started to learn, oh, anatomy is really very important. I wish when I was in med school, I listened more, because in the cadaver dissection when I was in med school, I wasn't assigned the face. Me and my group mates, we divide the body. So I didn't do the face. So I don't remember. Now we have to pay for cadaver dissection, right? So that my advice really is for us to pay attention to anatomy. And when you know your anatomy, everything falls into place. Okay? So that's why we have to go through this. Now, how do you avoid these complications, right? Of course, you have to assess your patient properly, check their medical history, but also understanding the anatomy is really important. Now, I always say all filler injection, it's about using the right product with the right volume, okay, applying it in the right layer of the skin or the right anatomy with the best technique that you can do. Okay, so that's why we have to go through that. And that's where the Teoxan approach comes in, right? The one that I just said to you about the right product, the right technique, the right anatomy, it's actually also ATP. Okay? So ATP, I'm sure you've heard of this, but it's really very important. It's a very unique approach that no other company has introduced. It's about anatomy and assessment, followed by knowing the correct techniques and using the correct product. Now, for the ease of discussion, I would do it a little bit different. I would do A and then P and T, just for the ease of discussion, right? So let's go first to anatomy. Now, anatomic features of your lips. Okay, you just have to recognize your landmarks. Of course, your philtrum columns are the vertical lines coming from the upper vermilion. Okay, your upper vermilion is your top lip, and then your lower vermilion is your bottom lip. The borders of your lips are your vermilion border. Okay, now the one that you see from outside, that's your dry lip, meaning that's lip that's dry. It's the one that's red. But underneath, okay, you have your wet lip as well, and that's where your lips are because of your saliva. Then it's wet. It also has some glands there. Okay, and now later on, I'll tell you why it's important to distinguish as well between the dry and the wet lip. Now, in your vermilion border, you have this like virtual canal. Okay, so you have that space there where it's really very convenient to put your filler on. So you can see from the cadaver dissection, the one with the gel, the purple gel is like a colored filler. It's simulating where you can potentially put your filler. Okay, so it's the junction between the white and the red lip. Now, on sagittal section of your lip, you would see this structure. Okay, very interesting. The dark red is actually your orbicularis oris muscle. Okay, and it has two parts. You have your peripherales, which is sort of the outer part of your lips, and your marginalis, which is on almost like on the vermilion border. If you can see, this is like a hockey shape. Okay, that one. All right. So you, since your lips has two parts, movements of different parts or contraction of different parts of the muscle would lead to different movements, such as pursing of the lips, closing the lips, okay, kissing, and all of that movements. Now, aside from the lip movements, you also have a lot of muscles attached to your orbicularis oris muscle. So you have your zygomaticus muscles, you have your depressor muscles, you have your levator and your smile muscles. Okay, so around actually 18 muscles. Why? Because the lips and the mouth, it involves speech, it involves expressions, different kinds of movements. That's why there's a lot of muscles around it. And this tells us that the lips is a very dynamic part of our face. Okay? And when you have a dynamic part of the face, it also tells you that you also have to use a dynamic product in order for it to look more natural. Okay? Now, always we ask ourselves, what is the danger area of the lips, right? Where can we inject safely? So the lips is a very vascular structure. That's why we have to be aware of the blood supply. Okay, so the main blood supply will be coming from your labial arteries, and these are branches from your facial artery. Your facial artery will arise from the body of your mandible. There's a notch usually here. It appears by the body, okay, and then but it's very deep. As it goes up around the risorius or the corners of your mouth, it gives off two branches. Okay, so you have your superior and your inferior labial arteries. Now, your superior artery would be puncturing your orbicularis oris about 1/3 from the oral commissure. Okay, so it goes a little bit superficial and then goes deep to puncture the muscle, and it goes into the submucosa after that. Okay, so what does this tells us? So it's about 1/3 from the oral commissure. Around this area, the the superior labial artery would puncture that muscle, so it's a little bit superficial here, and then it goes deeper inside. Okay, and it would go under the submucosa, right? So again, just to show you a video, the danger are your blood vessels. Okay, so you have your labial arteries, and is the artery? Again, I want to emphasize this because I want the picture to be stuck in your mind every time you inject. Okay, so in cadaver dissection, when you open up, you'll see the facial artery. Okay, this is your facial artery. And here you can see this tortuous structure. It's your superior labial artery. Okay, it then punctures your orbicularis oris muscle there to reach the submucosa. Okay. Now, so what are the possible positions of your labial arteries? It can be in your submucosa, which is most of the time, especially more mid-air. Um, no, I mean, yeah, most of the time. And then it can also be intramuscular because remember, it does puncture your orbicularis oris muscle. So it goes through that. A very short time, it would be there. Okay. And then, of course, it can also be located in your subcutaneous layer. So it does vary. There is a heterogeneity in the position of your labial arteries, but most of the time, it would be in your submucosa. Okay, so about 70 to 80% of the time, it's in your submucosa. Okay, well, thank you. Um, a short time, it can be as well intramuscular, and very rarely would you find it in the subcutaneous layer. Okay. All right. So there, it's about 78%, almost 80% that it is located in the submucosa. So that's why you have to be careful when injecting filler into the lips. Okay. The submucosa is a higher risk area. I know there are some techniques which also inject into the submucosa, but that requires a level of precision and expertise and, close monitoring of the patient. So the safest area would be really to inject it into the subcutaneous area because you would rarely find your vessels there. Okay. So I was telling you about the dry and the wet lip. Okay. So also the dry lip is it's a relatively safer area because once you go into the wet area of the lip, then you potentially can also encounter your blood vessel there. Okay. And then this is for the lower lip. You can see that your inferior labial artery is already on the mucosa or submucosa of the wet lip. Okay. So the lower risk area would be to start your injection would be on the lateral vermilion on the subdermal plane. You have here the lowest chances to encounter your vasculature. Medium risk would be in the middle segment as well as higher risk on the near the cupid's bow. Okay, the oral commissures are the way end. There's also a possibility you might see the artery just because that's the area where it starts before it punctures into the orbicularis oris. All right, so just have to be careful with that. Occasionally, if you like stretch the skin, you might see the artery even. You might even see the pulsation. So if you're able to see,
Nếu mà bạn có thể thấy nó nên là né tránh cái điểm vào ở của cái vùng này và chọn cái điểm khác để tiêm một cách hiệu quả hơn. Một lần nữa, những cái vùng ít nguy hiểm hơn, an toàn hơn, không có vùng nào ở trên mặt là 100% an toàn. Tất cả những vùng trong gương mặt đều có mạch máu để nuôi dưỡng. Báo cáo viên quốc tế đều chia sẻ điều này và khi mà tiêm vùng nào cũng có những cái nguy cơ.
you're not doing as much patients, okay, or you're lying to me, right? Eventually you might encounter some. Okay, me in my lifetime, in 13 years of doing this, I've already encountered 3. 1, I was not able to reverse. 2, I was able to reverse because I learned from the 1, right? So, and even if we encounter these, it makes us grow, it makes us learn, but it also helps us to prevent it in the future. Okay? So again, that's why education is important. Right. So now we go to the assessment. How do we check and how do we assess our patient? When you look at the patient, of course, you do an interview first. You ask them, what do you want? what do you want to achieve? Most of the time, your patients would even show you photos of their celebrities or Instagram that they follow. Oh, I want this, I want this. Of course, you have to try to manage their expectation. But looking at your patient, you check for the proportion, the left and the right. Very, very, very common. Not everybody has symmetrical lips, right? Sometimes one side is larger than the other. Okay, so you have to also note that to the patient. You have to tell your patient your observations. So one tip, you tell the patient before, okay, this is not symmetrical, all right? I will do my best to make it symmetrical, but sometimes even after the procedure, that's how lips is. That's how the shape is, right? So you just have to manage your expectation. Now check the shape, check the volume of the lips. Is it full? Is it small? Okay. On the lateral view, check if the lips is flat or is it projected properly. Okay. Ask them to smile, to make movements, to kiss. Oftentimes, when the patient smile, the lips even flatten or disappear. Right. Also check the dentition, the gingival state. Do they have gummy smile? Okay. And of course, look at the total harmony. How does the lips fit into the face? The ratio between the lips and the face. Certain races, certain profile, it looks good when they have full lips, right? If patients have a very small face, sometimes it doesn't look good if they have too big a lips, right? So you have to match it as well with, everything should be in harmony. Okay. Of course, you have your line. You can also use the Ricketts line or this line. It really depends. They say that the bottom lip should be a little bit more projected. If you use the Ricketts line, about 2 millimeters for the Ricketts line, and for the top lip, about 4 millimeters. But for me, it really depends. Definitely, I don't like this. The last one, because if you watch the cartoons The Simpsons, it's the top lip is projected too much. So I prefer either the first one or the second one, because the lower lip should be slightly larger or slightly projected than the top lip. But also compare its relation to the tip of the nose and the pogonion, or the tip of the chin, which is your Ricketts line. Okay. Of course, ask them to smile. If your patients have gummy smile, you might also think of doing toxin to the lip levators. Okay, it would also help improve the total quality of their smile, aside from treating the lips. Notice also that there are some smiles, if they smile, the lips flatten too much. So then it might help to do a little bit of definition in these kinds of patients, right? And again, combine it with toxin, and as with any procedure, combination treatment is the best. All right. So I mentioned about this, ask about what their desires, their expectations, and then from there, do your treatment plan. Okay. Explain to the patient thoroughly what products you will be using. Explain if you're going anesthesia, if you're doing a block or you're doing just topical. Me, I like just doing topical because I want things simple. For me, the block is also painful. But I've learned to make my technique as least painful as possible as well. Okay. And then explain about side effects, especially about bruising. Explain to them about swelling, because oftentimes it will shock them. The lips easily swell, right? One thing I also explain to my patient, explain the possibility of vascular occlusion or necrosis. It's very important that they are aware, because if they are aware, they can watch out for it. Okay, so all my patients that I do filler for the chin, for the nose, for the lips, nasolabial or glabella, I ask them, okay, when you go home, before you sleep, take a photo and then send it to me. And then the next morning when you wake up, take another photo and send it to me, so that I can see if there are any signs of vascular occlusion. Because sometimes the patient doesn't know. They thought, oh, it's just a bruise. But us, because we're trained to identify between a bruise and a vascular occlusion, then we'll be able to say. Because vascular occlusions, if it happens within 24 to 48 hours, there will be signs, and you should be able to reverse it if you have hyaluronidase. Okay. I was able to reverse a vascular occlusion about more than 3 days after. So, but it was I was very nervous. I couldn't sleep because I was waiting for it to resolve, right? So another advice is always to inform your patient and then send photos, okay? And of course, have hyaluronidase always ready in your clinic. You cannot have a filler practice without hyaluronidase. Okay, you cannot say no. I'm a good doctor. Oh, it's very rare you get vascular occlusion. I don't need hyaluronidase. But when it happens, you'll be nervous, and especially if the patient calls you in the middle of the night, you can't find any sales rep who can sell you hyaluronidase. Then you know it's just going to be a problem, right? So again, be ready, right? So now let's go to the techniques. Okay. So the techniques vary. Different doctors have different techniques. Okay. Very common is injecting it into the vermilion border. If you inject it into the vermilion border, usually the effect that you would get is more of definition and projection. Now, you can also inject it in the subcutaneous plane or the dry lip. It would give you a little bit more projection as well and volume at the same time. If you inject it into the intramuscular plane, you really would get full lips. So a lot of, I know Caucasians, they like full lips. And if you inject it into the submucosa, you would get eversion or, you know, the lips pout a little bit more. Okay. Now, the last two ones are the higher risk procedures. Okay. And also for me, I'm not a fan of eversion. Probably because for Asian lips or Filipino at least, our lips are a little bit normally full. So I'm lucky that Filipinos, they don't demand eversion or pouting lips. Most of the Filipinos, my patients, they just want definition. They want it to look natural. And here in Vietnam, they also feel the same. They want natural lips, right? But I'm sure sometimes some patients, they want big lips, right? So again, have to manage their expectations. Okay. Now, the problem sometimes when you inject a superficial into the subcutaneous plane is that it can stiffen the filler at the lips, or sometimes the filler becomes a little bit obvious. All right. So the recommendation that I would, suggest is that you need to use smaller amounts, and also you need to use the correct product, a soft gel, so that it would look natural and the filler will not be visible. Now, sometimes you are using the correct filler, but you put too much, then it can also be visible. All right. It can look unnatural. All right. So again, just to summarize, the guidelines. So because your label artery enters a bit posteriorly, it allows lower risk for you by injecting more superficial. Okay. The lowest possible needle gauge you can use. I usually use a gauge 30 needle. Sometimes I'm able to even use 33 or 32, although it's a bit hard to push if I use even more soft filler. Okay. You can also use cannula. I know some doctors use cannula for the lips, but it's a little bit more painful, right? So injection technique, when you inject into the lips, it has to be very slow. So injecting slow helps reduce the chances of bruising. Okay. It also helps reduce the swelling, but at the same time, um, you're able to control more. The secret with injecting lips is precision. Okay. Because the lips is a small organ, it's a very delicate organ. You have to inject it precisely, slowly. Okay. You have to be patient with the lips. Okay. Now, the smallest possible volume as well should be injected. With fillers, you can always add more if the patient wants more. Okay, me, I want to be conservative. I can put the minimum amount that I think the patient would be happy. Of course, there will be some swelling, but ask them to follow up after 2 weeks probably. And then if they want to add more, you can always add more. Okay. So different techniques. This one just shows you some injection point if you're using a 4 millimeter needle. So it's a very tiny needle, 4 millimeters, right? One of the smallest. Um, because you have a virtual canal, okay, when you inject here with just one point, and then slowly fill, the filler can already travel directly up to the cupid's bow with just 1 point. If the patient's lips are small, right? I can sometimes also do the same technique and but do 2 injections. That's fine. Okay. Or you can use the regular needle that comes with the package. I think it's 12 millimeter. Um, the best technique I think is to do anterograde because as you push the filler, it's the lidocaine works so that it numbs the area instantly. And then just do it very slowly to give time for the lidocaine to work its numbing effect. Okay. So sometimes I know some doctors or some countries they do like boluses on the lips. They want the Russian lips or they want balls there. I'm not a fan of that. If that's what your patient wants, yes, you can also do it. But I usually rather prefer just to do more of definition of the vermilion border. Okay. So inject it into the subcutaneous because it has the lower risk for intraarterial injection. As you can see, you'll be depositing your filler usually around here by the vermilion border, or if you want more projection by the dry lip, and you can see the artery is here, so you have to avoid that. Right. Now, later on, I'll show you the actual technique, just a video, right? But I just want to go through the importance of having the correct product, okay? So it's important to have a resilient hyaluronic acid. By resilient, it means that it's able to adapt and stretch according to the movement of the lips as well. Because your lips is a very dynamic organ, it moves a lot, okay, and several muscles are attached to it, right? You also need the filler that can go through with all the movements, okay? Okay. So also you want to mimic the natural hyaluronic acid of the skin, okay? Because the natural hyaluronic acid of your skin is actually also very dynamic, okay? So that you can have more natural results. So that's why RHA is one of my, it's actually my favorite filler, RHA, because of this molecule. All right. So observe how this bond breaks and then reconnects. Okay, it breaks and reconnects. So RHA, the main feature is you have long chains of high molecular weight HA, and then you only have a small cross-linking of about almost like 2 to 4%, depending on which RHA. So these are your classical cross-linking, but you have these labile and mobile bonds. These labile and mobile bonds detach and reconnect. So the advantage of that is your molecule becomes elastic and strong at the same time. Okay, so it's able to stretch and go back to its original shape. Okay, and that makes it very dynamic. Okay, so other fillers, the problem is when it starts to break down into pieces under the lips, okay, because it's not very dynamic or um, very strong, it would start to accumulate water around it. So sometimes you get more swelling. Okay. Also, because it breaks down into smaller pieces, it can be lumpy or obvious. And it would also not last long enough because you have more surface area for your body's own hyaluronidase or hyalase to break down the filler. Okay, that's why if it's not dynamic, it also doesn't last very long. Okay, in my experience, lips generally, the filler for the lips doesn't last as long as other fillers on other areas of the face, right? And I'm sure you've had the same experience. But with RHA, in my experience, it can even it lasts usually longer than most filler, right? Now, we talked about two possible outcomes. Either
Ờ, bạn muốn là môi tinh tế hay là đôi môi đầy đặn? Nếu muốn môi tinh tế, cần phải thêm một thể tích vừa phải. Chúng ta cần phải lựa chọn RH2 ờ, liên kết chéo, RH3 thì có cái liên kết chéo cao hơn.
But notice
Và cần phải lưu ý là cả hai đều có cái lượng HA là 23 mg trên ml. Đó là lý do tại sao mà nó sẽ kéo dài lâu hơn. Theo kinh nghiệm của tôi thì filler ở trên vùng môi sẽ kéo dài khoảng 6 tháng. Cần phải lựa chọn mà chất làm đầy mà có độ căng giãn tốt và có sự gắn kết tốt. RH3 thì nó sẽ mạnh hơn, cái độ gắn kết cao hơn, sẽ làm cho môi trở nên đầy đặn hơn. Nếu bạn sử dụng RH1 chủ yếu để điều trị những nếp nhăn vùng môi, tôi muốn cho bạn coi một lần nữa. Khi mà chất làm đầy có thể break, có thể bị gãy ra khi mà chúng ta di chuyển môi, hoặc là khi mà hấp thụ nước đối với lại những loại filler trước đây. Hoặc có thể gây ra bị u nốt. Đây là những kỹ thuật. Trong cái video của tôi sẽ cho các bạn ba kỹ thuật. Đây là kỹ thuật sử dụng kim nhọn 4 mm. Bệnh nhân nữ 26 tuổi đã có tiêm filler cách đây 8 năm. Cô ta không muốn môi quá to, nhưng mà muốn môi tinh tế hơn khi mà cô ta cười. Thì cái môi dưới nhỏ hơn môi trên. Khi mà nhìn cái góc nghiêng, trường hợp này tôi sử dụng RH2 bởi vì cô ấy muốn một cái môi tinh tế mềm mại. Đầu tiên sẽ vẽ cái hình đường đi của mạch máu.
Your facial artery. Okay, so this would supply the blood supply of the skin iron around the lips as well. Okay, now this would enter about 1/3 from the oral commissure. Okay, so what I'll do with her is I'll use a short needle, a 4 mm needle, and just do one or two. I think I'll be doing 2 injection points on her. But as you can see, even with just 1 injection point, actually, you'll be able to see that it would already fill her lips beautifully. Okay. So this is your 4 mm needle. As you can see, it's a very small needle. You can barely see it. Okay. And notice how I'm just stabilizing the skin around it and then very gently injecting. Now, as I inject slowly, you can see the filler traveling across the vermilion border of the top lip, right? So just actually, even if I do just 1 injection, it can already fill everything. All right. You can see just 1 injection with a very short needle is already slowly filling up the entire right side of the top lip. Okay. So you can actually stop there, but me, just for demo purposes, I wanted to add just a little bit more because I think I was only able to use about 0.05 for that side. So just adding a little bit more to be able to just give a little more definition on that Cupid's bow. Okay, but you can see with just 1 injection point, it travels all the way to the middle parts. Okay, and then just give it a gentle massage, and then you can see that definition. So I think I use about just 0.1 for that area. Okay, And then I'm just gonna do the other side. It's played on fast forward, so you can see. So we can save some time. Again, I would do it. Uh, notice my other finger is always doing like a counter traction to stabilize the skin, and this fingers is stabilizing, so that I'm only using my index and thumb, but the other three fingers I use it to stabilize my and have more control. Okay, so that's just one tip for you when you're doing injection, even with other areas of the face. Okay, then just do gentle massage, right? And then I'll be doing the lower face. So I've been able only to use like around, I think, point two for the top lip. Okay. Now, then I'm gonna do more on the bottom lip. Okay. Slowly, you can see just with few injection points, you're able to fill it up. Okay. Right. So let us just finish it very quickly. Right. And then go to the middle. So I'm giving more volume to the lower lip. Although um I always tell my patients, although I'm doing more on the bottom lip, sometimes you will not totally achieve everything that you want because her top lip is still slightly larger than the bottom lip, even though I place only a little. Now, I normally also would put some filler on the bottom, on the middle part, just to give it that body. All right. So you can see a nice projection and a nice shape of lip. Although it's a little bit there's some swelling, I usually tell my patients it will go down maybe about 10 to 20%. Okay. So this is your before and after, and also from the side view. Okay. But this is immediately after when there's still some swelling. All right. So I use a total of about zero point 0.7 ml. So around zero point 0.2 on the top lip and then zero point 0.5 on the bottom lip. Okay. So I definitely used more on the bottom lip. Okay. Now, next video, I'm using a cannula, right? I don't commonly use a cannula just because it's a little bit more painful, but I use the cannula in this particular patient just because he has some deformity in the middle of his lips. Okay, and I see this very often also. So he's a male patient. Okay, his relative is around, I think, 24 years old. Okay, he's done filler with me a year ago. Okay, so you can see his lips are actually very full. But notice how there's like a small break in the middle. Okay. So that's why I said maybe I should use a cannula also to be able to try a different technique and show you. Okay. But he still wants more fullness of his lips. Okay. So again, even though he's a male patient, he wants something different. Normally, like I wouldn't recommend it for him, but I'll tell you why he wants full lips. Okay. But anyway, I'm using for him because he wants fullness and more volume. I'm using RHA3. Okay. Now, I'll just show you, I'll advance it a bit. Okay. So I'm using a gauge 27 cannula and I'm using a gauge 25 needle to make my entry point. So just very slight puncture there, small puncture. And then, so here's your gauge. First, I'll just go along the border of the lip, along the vermilion. Okay. So I didn't do a nerve block, but I did like topical anesthesia for about like almost an hour. Okay. So the patient can feel a little bit of it, but he has high pain tolerance, so he was able to bear it. And he said it was okay, it was bearable. Right. So I pushed the cannula all the way to the cupid's bow. All right, and then do both anterograde and a little bit of retrograde. Now from
Rút canul và nhả thuốc từ từ, và tôi đi từ từ và làm rất là chậm, và đi vào cái vùng giữa của môi trên. Tôi sử dụng cái ngón khác để giữ và đẩy cái canul từ từ. Tôi làm cái vùng đối diện.
First on the border, just to give the definition of the lips, and then a little bit on
Ờ,
the deformity in the middle. Now
ờ,
doing
tôi
the
tiêm vào cái đường viền cũng như cái vùng giữa của cái vùng môi
the
trên.
middle deformity, so it would also give him his lips a little bit more projection.
Ờ, sẽ làm cho cái môi của anh ta trở nên
Now,
căng đầy hơn.
so I also did the lower part.
Tôi cũng tiêm vào cái vùng môi dưới, tôi sẽ cho các bạn xem.
So you can see the topic once I touch it, right? It looks very even,
Ờ,
right? It looks
Sau khi tiêm thì môi trở nên rất là đẹp, và cân đối.
doing the bottom lip. You
Khi
can see it's just
tiêm vào
going
môi
to do the
dưới,
same.
chúng ta sẽ làm tương
Just
tự.
going to go along the border
Chúng ta đi dọc theo cái đường viền môi.
right? When you use a cannula, always
Khi sử dụng
go
canul,
perpendicularly to the skin, and then you can angulate it afterwards. So that's another secret to using a cannula.
ờ,
When you use a
ờ,
cannula, use a cannula perpendicular to your entry
ờ,
point, and then angulate it.
khi mà sử dụng canul thì bạn sẽ đưa cái canul vuông góc với lại cái điểm vào, và sau đó đi vào
This is not something I
cái góc
commonly do,
ngang.
but it's another
Đây là
option for
cái
some doctors. I
bí
know
kíp để sử dụng.
some doctors specifically
Ờ,
they like doing cannula.
Một vài bác
Some
sĩ thì
doctors
thích
say use
sử
cannula
dụng
to
canul khi
place
tiêm môi.
okay, so you can see the lips. Right, and this is the after. Okay. So it's definitely more full. Okay, and actually he likes it very much.
Và thật sự anh ta rất là hài lòng với kết quả.
Definition from the top lip. You
Ờ,
can
Chúng ta
notice
thấy là
there's
môi
more
trên nó
projection in the
tinh
nose.
tế
There's
hơn,
a little bit more projection
và có độ nhô
look
ờ,
nice.
trông vẻ đẹp hơn.
So these are the photos.
Đây là cái bức ảnh trước và sau khi tiêm.
Now you're wondering
À,
why
bạn
he wants bigger
à,
lips, right? So
bạn đang đặt câu hỏi là tại sao anh ta muốn môi to hơn. Bởi vì anh ta
Performers is drag queen.
muốn
He's actually part of the
có cái
competition
môi
for
giống như drag
Miss
queen
Philippines, if you're familiar with
Mariana
that,
Summers.
right? So he's competing. He's actually just a secret because he's airing. He's top two. So we don't know if he's gonna win, but hopefully he wins. It's just a secret.
Đây là cái bí mật của anh này.
You're not Filipino, so it's okay. I can tell. Anyway, another male patient. Actually, he already has full lips. But for this patient, I just use the
Ờ,
regular millimeter needle.
Bệnh nhân này tôi
I
sử
opened the
dụng
pores so
kim đầu
his
nhọn
lips are very full, right? And just gave it definition. And
cho
this is a
môi trở
perfect
nên
face,
tinh tế,
but at night it becomes evil and queen.
và làm cho
I'm not
môi
sure
giống
what the
như
signal
cái
was
cô
using
Ella
on
Queen.
now, but they're in the entertainment industry, so they are
Trong cái
models and
nền công nghiệp
CEOs for
giải
them.
trí.
So for them, they like full lips because when they do their makeup and their lipstick, usually they do lip
Ờ,
liner
ờ,
over their
Họ sử
forehead.
dụng
This time
cái
they don't need to go over
trang
because
điểm, dùng nhiều cái kỹ thuật cho môi như là eyeliner hoặc make up cái môi, và nhiều người dân thì muốn cái môi giống
anyway, let's go to our
người nổi
second
tiếng.
patient this time because most of our patients who do lips are female, right? So I just wanted to present to you something interesting, of course, right?
Đây là điều rất là thú
So
vị.
this patient, this is actually the more common technique that I do.
Đây là
Just the
cái kỹ thuật mà
regular
tôi thường làm
needle
hơn,
that comes with your
với lại
package.
kim 12 mm.
She's 35 years old.
Bệnh
She's
nhân
active in Vietnam
35
again.
tuổi.
So you can see the face features. All right. Now with Indian, our Indian people, we say Indian nationality. Usually they have
Bệnh nhân người Ấn Độ thì cái môi dưới mỏng
I
hơn.
think you only black the Philippines. It's not like the usual full Indian lips, right? But one thing I like about her is
Ờm,
she really has a nice shape.
Con này
So
có
she
cái
was
môi,
showing me
cái
photos
khuôn môi khá
on
là đẹp.
Instagram. I want these lips. I want fuller lips.
Nhưng mà cô này muốn thì cũng muốn cái môi nó đầy đặn hơn.
Okay.
Tôi chọn RHA3. Cái tỷ lệ ở
Small.
cái vùng khi mà nhìn nhỏ thì khá là ok, nhưng mà cái môi dưới thì khá là nhỏ. Người ta muốn cái môi dưới trở nên nó tinh tế tươi mới hơn.
These kinds of patients I love to do because the shape of the lips already looks nice.
Con này thì cái khuôn môi đã đẹp rồi. Để tôi vẽ cái đường đi của mạch máu.
So this is green 30
Đây là kim
I'm using a harsh
30G, sử dụng là RHA3. Tôi tiêm chậm. và tôi đưa cái chất làm đầy vào phía trước. Sau đó tôi rút chậm kim ra và thực hiện rất chậm, rất chậm. Bệnh nhân hoàn toàn không cảm giác gì hết. Và sau đó
Okay, and then another injection here. So I like doing this just because I have more compared to the 4 millimeter needle. I like doing this because I have more control and or on when where I put the filler. Okay. Okay, so I do both anterograde and retrograde injections. And then usually once I do go there, I push a little bit more to give more body to the Cupid's bow and to be able to highlight Cupid's bow. So one thing also when you're doing lip filler, I rarely would put anything on the Cupid's bow because if you put filler there, you might make it round and the Cupid's bow would lose its curve. All right. So I'll do the other side. Okay, bevel up. So when you use the needle, bevel up, inject it very slowly, stabilize the skin with your other thumb or finger. Again, you can see my other fingers on the face, so it's also stable. So when I'm pushing the syringe, it's very stable. There's so much control. As I mentioned, lip filler involves a lot of precision and control. Okay? So again, so when my second injection, usually there's already lidocaine there, so the patient doesn't feel it anymore. Okay. So when you do it this way, I will tell you, your patients tell you you're really good because they almost don't feel the pain. Okay. Again, then I'm just going to do the lower or the bottom lip. But you can see the top lip, it already looks good, slowly forming. All right. Usually for the bottom lip, I would do like maybe around um, two injections on each side and then one in the middle. So there's like 5 small punctures. Okay. So this is the second injection going towards the middle. All right. So I'm doing both again, anterograde and retrograde injections. And then doing gentle massage afterwards. Okay. And then completing it to do the other side. Right. So just to let's just forward it a little bit because it's almost done. Now she does have some asymmetry. If you notice, it's not very obvious, but the right side is a little bit bigger. So I think I placed a little bit more on the left side. So just doing some in the middle and then massaging it. I don't like the Russian lips or the ones with they put like balls into I don't like the round balls on the lips. I want it to be smooth and more natural. Here, I think I'm just, just just making sure that everything is symmetrical, adding touch-ups here and there. Okay, I'm adding a little bit more on this side because this side has less volume. All right. So it's just on fast forward so I can show you. Okay. So just finishing touches, and then this is the final result. Massage it. So I have my staff doing this cotton pledge to make sure that there's no bleeding and no bruising. All right. So this is the final result, how it looks. You can see her lips. It actually looks very natural. It's more full. Okay. But notice how she's okay. It's not very traumatic. You don't see a lot of bleeding or bruising. Okay. And then when you turn it from side to, I gave her top lip really nice definition and more volume or fullness on the bottom lip. Okay. So when you turn it from side to side, you can see projection. Okay. Looks really very nice. Now her bottom lip is more projected as compared to before. Okay. And here she's smiling. Even as she smiles, it looks very nice. It looks very natural. Okay. So there you go. So that's the last patient was so she's trying to make love to the camera, right? So she really likes it. She's very happy with it, actually. All right. So these are just the still shots before and then after. after, you see an improvement in the volume and fullness, but it still looks very natural from the side view. Okay. Now this has some swelling, so it might go down maybe about 10%. So just to show another example of other patients that I did, for her, I use also RHA3 just to give volume and fullness to the lips. She's a millennial, she's a gamer, streamer, she's always on social media. So she really likes that she has good lips, right? Now, I just want to show you an example, a very interesting case that I've had. So she came to me, she had some permanent filler injected for her by in another clinic, and someone who did her was not a doctor. She was a nurse, because in the Philippines, nurses are not, yet allowed or certified to inject um, fillers. But for 6 years, she had these lumps and bumps on her lips that she had to bear with. And I said, ideally, you have to go through surgery to have it removed. She's had like steroid injected as well on the bumps, but it didn't work for her. So I said, okay, one thing I can try to do is I'll use filler to sort of mask and to cover the bumps and the lumps. So at least it would look more pleasing, right? So this is what I did. So I used a cannula for her. What I did was to cover the lumps and bumps and to also try to improve the shape of the lips. Okay. And this is how it looked before and after. And she was really very happy. She actually was crying because she said, for 6 years, I have to bear with my bumpy lips. And now it looks so nice. Right. So I used RHA3 on her, natural looking results, and she was really very happy with it. Okay. So there. Now, just to summarize everything, key points to remember. If you want subtle lips with a beautiful contour or definition, you have to use RHA2 with something with good stretch.
HA3 bởi vì nó có cái độ giãn và cái độ gắn kết tốt. Nếu bạn muốn có một môi đầy đặn, có độ mạnh hơn và giãn tốt hơn, sử dụng RHA3. Tôi không khuyến nghị là RHA4 vì nó quá cứng cho môi. Và kết lại, tiếp cận corticosteroid để làm tươi đẹp môi, đầu tiên bạn phải có một am hiểu kiến thức về giải phẫu của môi. Đánh giá bệnh nhân một cách đúng đắn ở cả tư thế tĩnh và động, khi hỏi, nói chuyện với họ để biết họ muốn và họ cần cái gì, lựa chọn đúng cái sản phẩm. Và suy nghĩ về cái ATP, về giải phẫu, kỹ thuật và sản phẩm. Để kết thúc lại, bệnh nhân khác nhau sẽ có những cái mong muốn và nhu cầu khác nhau. Thỉnh thoảng tôi có những cái bệnh nhân nam và bệnh nhân nữ và muốn có những cái môi tinh tế. Bạn phải tôn trọng cái giải phẫu của mỗi khách hàng và sử dụng sản phẩm tốt nhất cũng như cái thuật riêng của mình. Vì vậy, bạn có thể mang đến cái sự tự tin và làm cho khách hàng hạnh phúc. Do đó, bạn cũng sẽ hạnh phúc. Cảm ơn rất nhiều vì đã lắng nghe cái bài thuyết trình của tôi. Cảm ơn.